Hi guys, this is a short video on Chalazion. So, what is Chalazion? It is a chronic non-infective lipogranulomatous infection of meibomian gland. So, it is a chronic non-infective lipogranulomatous inflammation of meibomian gland. And what does this causes? It is due to duct obstruction. So, the duct of meibomian gland is getting obstructed and that will lead to the retention of sebaceous secretion. Coming to the etiopathogenesis, first there is a mild infection or hyperkeratosis, and that mild infection or hyperkeratosis causes the duct blockage. So the duct of meibomian gland is blocked. Now due to the blockage there will be sebum secretion and retention. So this retention will cause gland enlargement. And due to the irritant effect of this secretion, there will be a chronic granulomatous reaction which will result in giant cells, epithelioid cells and lymphocytes. So this is the etiopathogenesis. Coming to the clinical features, the symptoms include painless swelling. It is a painless, gradually developing swelling, and there will be heaviness to the lid. Then there will be blurred vision due to induced astigmatism and epiphora if it mechanically everts the punctum. So there will be painless gradual swelling, then that due to that swelling there will be heaviness of the lid, and then due to its close contact with cornea it can induce astigmatism and epiphora if it mechanically everts the punctum. Signs are they will be firm to hard, non-tender nodule. So they are painless and non-tender, firm to hard nodule slightly away from the lid margin. If they are directly on the lid margin, they are known as marginal chalazion. But if they are away, normally the chalazions are away from the lid margin. Now, the swelling is fixed to the tarsal plate, but the skin is free and mobile. So, the swelling is fixed to the tarsal plate, but the skin is free and mobile. And on eversion, the conjunctiva appear reddish purple or grey. So, first tell that is a hard non-tender swelling away from the lid margin. If it is on the lid margin, it is known as marginal chalazion. And the swelling is fixed to the tarsal plate and the skin is free. Conjunctiva appears reddish purple or grey or eversion. Now, the important part, the complication. So, first complication is hordeolum internum, that is secondary infection can lead to acute separation. Then there can be granuloma or fungating mass formation when they burst inside the conjunctiva. Then there can be mechanical ptosis due to the weight, and then calcification and malignancy. So recurrent chalazion in elderly, we have to consider sebaceous gland carcinoma. So what are the complications? It can be hordeolum internum, granuloma, mechanical ptosis, calcification and malignancy. Coming to the management of chalazion. First, hot conservative management. So we can do hot fomentation or warm compress, topical antibiotic, steroid combination. Then we can do intralesional injection of the steroids like triamcinolone. First we can give topical antibiotic steroid combination, then intralesional injection steroids like triamcinolone. Now coming to the surgical part, that is incision and curettage. So here first we will give anesthesia by local infiltration or drops. Then we will take a clamp and that clamp is known as Chalazion clamp. Then we will make an incision and the incision is usually vertical incision. So vertical incision is done to avoid the gland damage. Adjacent gland should not get damaged. So we will get a vertical incision. Then we will do curettage so that the contents are scooped out. And then now there is a formation of a cavity. So this cavity is cauterized using carbolic acid to prevent the recurrence. Okay. So anesthesia by local infiltration or drops. Then we will apply Chalazion clamp. Then incision, vertical incision to avoid adjacent gland damage. Then curettage, the contents are scooped out and there will be a cavity. So we will cauterize the cavity with carbolic acid. Then systemic prophylaxis with oral tetracycline or doxycycline can be given in recurrent cases associated with acne, rosacea, or seborrheic dermatitis. So this was all about Chalazion. It is a short topic. So thank you.